Well, we now have data that sheds light on just how damaging it was to overturn Roe v. Wade. I'm Brittany Page. This is the Page Perspective. Thank you so much for being with me today. Before we get to that data, I want to talk about a few things that came up in the comments on my previous video, the conspiracies surrounding fentanyl and Halloween candy, that video. I just want to say, not to gloat too much, but no headlines about kids overdosing on Halloween candy that had fentanyl in it. So I think so far we have a pretty good track record here on this channel for factual information. Just not to gloat too much, but I just want to make note of that. Pretty good track record so far. So a few of you have noted, Brittany, you don't have a fancy backdrop. That is correct. This is actually the room where we film I Doubt It podcast. I'm sorry, not film, record, where we record I Doubt It podcast, the podcast that I have co-hosted with Jesse Dollemore for 8 years, I think going on 9 years. So the plan for this channel is to do 3 videos per week on Monday, Wednesday, and Friday. That is the plan. That could change. So be sure to subscribe, click that bell ringer button so that when I upload a video, you will get notified and you can see it then. The plan is to cover my favorite topics in politics, activism, psychology, public policy. So if you have topic suggestions, feel free to leave a comment below and I will be sure to look at it and consider it. Also, share the channel with a friend, anyone that you think might be interested. I would really, really appreciate it. So let's get to this data set that FiveThirtyEight got a hold of. And the midterms are coming up. We have 4 days before the midterms, and voters seem to be right now most concerned about inflation. In the polls, when they are asked, inflation is top of the list. And this is concerning for a few reasons, because oftentimes voters will say, well, I'm concerned about inflation, how expensive things are. Justifiably so, but then they will say, that's why I'm going to vote for Republicans, because I believe they will solve that problem, even though their solution is to cut Social Security and Medicare and to give more tax breaks to the rich. So it's not going to solve the problem. The issues that seem to be falling down that priority list are increasing fascism and abortion. We're going to talk about abortion today. You know, the thing that Dr. Oz, Senate candidate in Pennsylvania, believes should be between the person getting an abortion, the doctor, and local political leaders.
Erica, 60 seconds.
There should not be involvement from the federal government in how states decide their abortion decisions. As a physician, I've been in the room when there's some difficult conversations happening. I don't want the federal government involved with that at all. I want women, doctors, local political leaders, letting the democracy that's always allowed our nation to thrive to put the best ideas forward so states can decide for themselves.
A truly remarkable clip that I will never get tired of playing. So, since the overturning of Roe v. Wade, we have seen so many headlines, stories about children having to flee across state lines to obtain abortions after a rape. We've seen stories about people not being able to fulfill their necessary prescriptions because it can cause an abortion or it can interfere with fertility, even though the medication that they need is not at all for anything related to an abortion. We've seen women risking their lives to carry non-viable pregnancies because doctors refuse to terminate. And now we have data to give us a further glimpse into the damage that has been done by Republicans by overturning Roe v. Wade. And this data comes from an organization called We Count. It's a national research project led by the Society of Family Planning, a nonprofit that supports research on abortion and contraception. And this data set was shared exclusively with FiveThirtyEight, and I want to read from this very important reporting from FiveThirtyEight now. A data set shared exclusively with FiveThirtyEight shows that in the 2 months after the Supreme Court decision, there were 10,670 fewer abortions as compared to pre-Dobbs estimates. That figure is a net, counting both declines in some states and increases in others, and it shows how a few states are absorbing some but not all of the demand for abortions in states where it is now banned. Between April and August, the number of abortions declined by 6%, and it's likely that the decline in abortions represents thousands of women who sought abortions illegally or didn't get one at all. If these trends persist, there could be at least 60,000 fewer abortions in the next year as a result of the Dobbs decision. So in just the first 2 months following the SCOTUS decision, more than 10,000 people were unable to access abortion. Now, it could be that some people are getting an abortion without going to a clinic or without going through a doctor and getting pills online, for example. But it's also likely that many people are carrying unwanted pregnancies to term because they have no other choice. We'll get to the consequences of that in a minute, but just like with other abortion restrictions, we knew that overturning Roe would prevent a significant number of abortions from happening. Just making an abortion unaffordable stops them from happening. And I want to talk about an important book, the Turnaway Study, 10 Years, 1,000 Women, and the Consequences of Having or Being Denied an Abortion. This is by Diana Green Foster. We actually had Diana Green Foster on I Doubt It podcast for an interview. If you are interested in listening to that, it'll be linked below. And in that book, she writes, probably as many as a quarter of women who want an abortion but can't afford it carry the pregnancy to term. In the United States, state law and clinic gestational limits alone prevent at least 4,000 women from getting wanted abortions each year. And this is an important study because it's the first longitudinal study to actually examine the consequences of being denied a wanted abortion. And what are those consequences for women, people who are denied wanted abortions? Well, it's increased risk of health problems. It's increased risk of poverty. It's struggling to leave unhealthy relationships. And let's look at what the data found in the Turnaway Study. Women who obtain wanted abortions have lower immediate physical health risks and improved health outcomes over the next 5 years following an abortion. They have increased likelihood of having wanted children later on, happier romantic relationships, lower poverty, less dependence on public assistance. You know, the thing that Republicans claim to care a lot about, wanting people off public assistance. Well, if you're forced to have a child that you don't want or that you can't take care of, that makes that pretty difficult, I think. Women who obtain wanted abortions have greater ability to take care of existing kids, increased ability to set and achieve aspirational life goals in the year following an abortion. And according to this 538 article, We Count, the organization where they got this data set, they're also looking at whether infant mortality will increase in states with abortion bans, because that's a possibility, right? 538 is also reporting that wait times for abortions have created a situation where abortions are now happening later in pregnancy. The Center for Disease Control and Prevention estimate that only 7.7% of all abortions happen between the 14th and 20th week of pregnancy, but between 20 and 30% of current patients are in the second trimester at Whole Women's Health of Minnesota, a clinic located in a state where abortion is legal until the point of fetal viability around 25 weeks. So the actual times that people are obtaining abortions are happening later in pregnancy. Isn't that what the Republicans claim not to want? It seems like overturning Roe has only caused harm and that there is no benefit. I wonder who could have told them that that would be the outcome. I wonder if they knew that that would be the outcome. And I wonder if these are the intended consequences, what they wanted to happen. There's many things to be concerned about right now: inflation, high cost of living, but we cannot lose sight of the party that is intent on inflicting pain and terror in the lives of those who are unable to obtain wanted abortions, among other things, and the negative consequences that will continue to ripple outward because of the choices and actions that Republicans have taken, specifically on the issue of abortion. So I hope that everyone keeps this in mind as they head into the midterms. Listen, I'm stressed about the midterms, but I'm staying optimistic. I wonder if you're in the same boat. Please let me know in the comments below. You can also call us 657-464-7609, or you can email us at idoubt@dollamore.com. We have a Patreon page that you can support us at too, patreon.com/idoubtitpodcast. Listen, this is new. We are just getting this off the ground. I so appreciate your support while I get it figured out. I'm getting my flow down. I'm figuring out what I want to talk about and how things are going to work. And I appreciate all of the supportive feedback that I have received from all of you. So thank you. I look forward to continuing these important conversations with you, and I will see you next time.